This session will focus on the theme Vedic Ayurveda, the Vedic health science. And the goal for this session is to learn about Ayurvedic healthcare practices for a healthier society with the idea Sarvesham Swastir Bhavatu, may all be healthy. In this session, we have 5 speakers. Vaidya Rajesh Kotecha, Secretary Minister of Ayush, New Delhi, Government of India, who will join us virtually. Dr. Jorge Luis Berra, Director, Foundation de Salud Ayurveda Prema from Argentina. Professor Dr. Tanuja Nesri, Director, All India Institute of Ayurveda, New Delhi, Government of India, who's also joining us virtually. Dr. Manoj Nesri, Advisor, Ministry of Ayush, New Delhi, Government of India. And Professor Dr. Mita Kotecha ji, Pro Vice Chancellor, National Institute of Ayurveda, Rajasthan. We will begin the session with Vaidya Rajesh Kotecha ji. He has over 30 years of experience in administration, higher education, scientific research, and institutional governance. He is a distinguished academician and researcher committed to innovative, dynamic, and well-organized work for the advancement of Ayurveda. Since June 2017, he is serving as Secretary to the Government of India, Ministry of Ayush. Kotecha ji has been the Chief Physician and Executive Director of Chakrapani Ayurveda Clinic and CEO of Chakrapani Global Center for Training and Research. For his outstanding contributions to the field of Ayurveda, he has received numerous recognitions and awards, including the Padma Shri, the Ayurveda Ratna Award, and the Global Ayurveda Physician Award, to name a few. He took the lead in COVID-19 crisis management, leveraging the potential of Ayush systems through research, development, and public health initiatives. Kotecha ji, due to some important work commitment in Delhi, could not be here. He has, however, very kindly joined us virtually, and he will address us on the topic, the journey and impact of Ayurveda on modern healthcare. Over to Rajesh Kotecha ji.
And also Professor P.A. Narsimurthy ji, the Chancellor, my friend Dr. Berra ji, my colleagues, Vaidya Manoj Nesri ji, Vaidya Mita Kotecha ji, and Vaidya Tanuja Nesri ji, all other dignitaries and participants. I'm very happy to be a part of this event, though I was supposed to come physically and my ticket was also booked, but before I could get the flight, I have to be here for some important work. So kindly accept my apologies for that, but I'm trying now to connect with you through this virtual mode. I'm delighted that this conference is having a very good topic and a possibility of impact on our thought processes, and will also be able to provide us some good leads, some good food for the thoughts. So that is the possible outcome. So in this global conference on Vedic ideas for a better society, the today's session, my topic, journey of and impact of Ayurveda on modern healthcare. I'll go through simple details. I'll try to speak as simple as possible, but with some very inner topics and thoughts. So we all know that Veda means knowledge, which is the ulterior idea of the existence of humanity. It is not mere information, but transformative knowledge born of inner perception, deep meditation, higher consciousness. The concept of Veda has always existed and is beyond the idea of time that we all know. Actually, Veda advocate that there exists a deep-rooted relationship between matter and soul and the universe and living beings, which have answers to all worldly problems. And it is not only a vast tradition of knowledge on all levels, but also spiritual. Moreover, values, guidance, and tolerance, there are many other fields for which today's global civilization owe to our ancient Vedas, be it mathematics, philosophy, technology, astronomy, medical science, surgical science, logic, languages, culture, or fine arts, etc. Thus, the contributions of Veda are immense to the modern world. Ayurveda, the oldest school of medicine known to the mankind, is one of the biggest contributions of Veda to the world. It is a treasury that has a solution for all healthcare needs. In Sanskrit roots, Veda means pure knowledge that we know, and Ayur means life. So when we look at the meaning of Ayurveda is to understand the total knowledge or science of life. And Ayurveda specifically is a time-tested science having a recorded history of thousands of years of highly evolved, healthy, and long-lived individuals. Historically, the origin of Indian medicine can be traced to Veda, basically Atharvaveda. The Darshan Shastra was also very much in vogue during the Vedic period. Its concepts and fundamentals had much impact on the scholars and science at that time. In fact, Ayurveda comprises 9 out of the 40 branches of this complete system of Vedic healthcare. Ayurveda is also Sarva Parishada Shastra, which means this system of healthcare is related to all its scriptures, takes into account even the mutually divergent views expressed in various philosophical systems, so far as they do not oppose the Ayurvedic concepts. The most nearest allied branch of Ayurveda is the Darshan Shastra, and there are similarities of some concepts of Ayurveda and Darshan Shastra, but as the prayojana, that is the aim of both Shastra are different, they have been advocated in a different way. Like Darshana uses its concept for moksha or salvation, and Ayurveda for the welfare of creatures, that is the chikitsa or treatment. So, methodology and principles of Darshana are immensely scientific in nature. The principles have become more applied and extensive in Ayurveda, although their metaphysical essence has been cautiously preserved in the practice of Ayurveda. Darshan thoughts begins from the origin of this universe and of Ayurveda also. Regarding the origin of universe, several theories are postulated, out of which one is Karya Karanavada, cause and effect relationship theory. Different darshanas have presented their views in form of Vadas. Sankhya Darshana has given its view in the form of Satkaryavada. In Ayurveda, Chikitsa or the treatment is being described in the terms of Karyakaranavada, basically the Satkarana, that is existent Karana, which is the base of Satkaryavada. So there is a big relationship between the Sankhya Darshana and Ayurveda that way. And it is its foundation, the foundation of Ayurveda, laid by the ancient schools of philosophical teachings like Vaisheshika and the school of Nyaya also. So all these different darshana has a deep impact on the practice of Ayurveda. It is holistic and cognized science rather than a science derived from laboratory experimentation. It is a science based on the direct experience of the fundamental laws of nature that govern our world. That way, it is the revelation of reality gleaned by the enlightened ancient scholars or rishis. So, when we look at today's civilization, Ayurveda has a huge influence on human beings. In practice, we see like Ayurveda Dinacharya, a daily routine. We still practice whether we know Ayurveda or not. Most of Indian households and in so many parts of the world, the daily routine is being practiced or as per the Ayurveda. It is still an example of how Ayurveda has an impact on human health and the practice. Even surgeries, concept of surgeries also came in practice in the Vedic period only. There are a lot of such references of surgeries in Vedas. That's the biggest contribution of India to the world in the field of science and medicine. The operative methodologies and specialized equipment were used in India since long. Sushruta is considered to be the father of surgical sciences. Recently, last week only, there was a event of Plastic Surgery Association of India at AIIMS Delhi. And they have, in the name of Sushruta, they have devoted the exhibition name in the name of Sushruta. And the exhibition was conducted for the plastic surgery technologies and new techniques, which was dedicated to Sushruta. From the advanced understanding of the human body to the innovative techniques of various surgeries, from a vast collection of natural herbs to the practice of deep meditation, the Veda paved the way for modern health and medical sciences. Till the medieval period, it was possibly the only system available in Indian subcontinent to cater to the healthcare needs of the people. So it means that there is thousands of years of practice in India and subcontinent. Uh, it was also considered the golden period of Ayurveda because post-Vedic period, there was evolution of a lot of good scriptures, texts like Charaka Samhita, Susu Samhita, later on Ashtanga Hridaya, Madhava Nidana, Bhava Prakasha, and Sharangdar Samhita, and so on. There are a lot of different texts have been evolved, and the evolution of science in a natural way has happened. The patronage for the system significantly declined during the medieval period, and there was also lack of Rajyashraya. Rajyashraya means support from the political leadership of the different parts of the country. Still, it survived till 20th century. It survived because of its core scientific contribution, to the healthcare needs of the country. And in 20th century, interest in Ayurveda rekindled. Even in 1900s, it have started to develop Ayurveda on scientific lines, and education of Ayurveda was institutionalized. Now you can see institutions of Ayurveda 150 years old, 175 years old, or 100 years old, or post-independence 75 years old. There are so many such institutions, nationally and internationally famous, and they have contributed a lot. The systems post-independence also got official recognitions and became part of the national healthcare network to provide healthcare to the country's citizens. Many renowned institutions, as I mentioned, did contribute into these newer solutions to the healthcare needs. Specifically, after 2014, Government of India initiated a series of measures to improve the position of Ayurveda as one of the major healthcare systems vital for catering to the primary healthcare needs of the country. A number of hospitals and colleges for Ayurveda were established. A lot more initiatives took place in research and development, education, national level institutions, etc. The vast amount of medical knowledge that has come down to modern times is the result of long evolution through trial and error, research studies, evidence generation, exchange of know-how between diverse communities and regions. Contribution of basic sciences also should be mentioned here because they have been able to provide the mechanistic aspects of Ayurvedic principles and practices, and there is a huge generations of evidence. To be precise, I would like to mention about the Ayush Research Portal that anybody can visit through Google. And on this research portal, more than 25,000 publications on Ayurveda only, and total 33,000 publications of all Ayush systems are posted there in a searchable format. And this is huge. And all these publications are either peer-reviewed journals, publications, or index journals. So there are a lot of science behind this, and that has contributed a lot of understanding. The another aspect of Ayurveda is that uniqueness of every individual in a most comprehensive way through Prakriti or the doshas. And this also gives the way, paving the way of personalized medicine, which is the most modern, considered most modern approach to the healthcare needs of the people. So, for example, we have a Center of Excellence at Institute of Genomics and Integrative Biology, IGIB, which is having a Tri Sutra unit and studying on the doshas and prakritis and how we can personalize the medicine or the healthcare need of a person based on the principles of dosha and prakriti. So that is and that has contributed a lot. There are a lot of good publications. Actually, from the other perspective, if I should mention, is the Ayurveda understanding of health and well-being through building today's health systems, and these systems need to be intimately connected to the communities. Because of this knowledge, non-severable link with the nature and lifestyle, Ayurveda has the capacity to deliver quality of healthcare. Quality should not mean just the treatments, but it should be promotive, preventive, rehabilitative, and social healthcare, community healthcare. It is important to remember that Ayurveda is about the knowledge of life and not about the disease, only disease management. So this simple to understand way of classifying the population based on Prakriti and then providing solutions has an immense contribution, immense potential. Looking at the potential, Government of India has recently launched Rashtriya Prakriti Pariksha Karyakram, National Prakriti Assessment Initiative through National Ayush Mission, and we have just started this in this April 2022, and we are aiming to cater the entire population through National Ayush Mission. Also, socio-cultural research suggests that health and the social fabric of communities are related, and the traditional health sciences are generally understood as well as integrated in communities and share a common ethos with them to deliver social, culturally sensitive healthcare. And it also provides the possibility of low-cost healthcare. How? Like we are also proposing the fourth tier of healthcare, where an individual should be able to help themselves and their family through simple measures like available resources around their home, through medicinal plants available in that area, or through their kitchen remedies. Simple solutions, but it should be science-based. That is what we are propagating, and it is largely accepted. Niti Aayog is also working on this recommendation, and maybe it will be accepted by the mainstream government. So this is a very important step. Another aspect is that, Government of India, Ministry of Ayush, through collaborative and interdisciplinary studies with all the big institutions like ICMR, AIMS, CSIR, DBT, all those institutions and mainstream public health delivery mechanism, we have studied a lot of large-scale studies on non-communicable disease management, communicable diseases like in COVID management, other public health initiatives, etc. So these examples are now being translated into public health delivery system. For example, the morbidity management of lipidinitis or filariasis is now also accepted by the mainstream public health delivery system, and it is also implemented. Or musculoskeletal disorders or osteoarthritis or non-communicable diseases. All these are now being implemented in an integrative model. So, lastly, before I finish, I want to flag and mention a very important thought that should be shared with everybody, and we all should think about that. That we all know that new philosophy of healthcare is moving from illness to wellness, from treatment to prevention, and early diagnosis, and from generalized approach to personalized medicine. So, as discussed earlier, I just discussed about Prakriti, etc. There are several similarities between the concepts of personalized, predictive, and preventive medicine, that is PPPM, and Ayurveda. So, search of novel models for integrative medicine indicates the need for collaborations between traditional systems like Ayurveda and contemporary Western biomedicine. So, we have a lot of such good examples. Like recently, we have tied up with Institute of Liver and Biliary Sciences, where we are working with them to understand the mechanics of Panchakarma, how Panchakarma works, how Virechana works, how Basti works. So this is possible through this PPPM approach of the biomedicine and its combination with Ayurveda principles. So this priority of Horizon 2020 is like a large scale world's commitment to the total health to an individual. It can be effectively addressed through integration of this PPPM model of biomedicine and Ayurveda. So, before I end, I once again thank all the participants, and I hope that with the knowledge of life through Vedas, the contribution of Veda into the practice through Ayurveda, communities and nature, the holistic perspective of Ayurveda is also needed and would be helpful in providing a more balanced approach to the solutions of One Health or public and private sectors in healthcare. Thank you so much. Namaskar. Pranams.
Thank you, Vaidya Rajesh Kotecha ji, for addressing us despite your busy schedule. We would be happy to host you in person another time at your convenience, and please do visit our university. Our next speaker for this session is Dr. Manoj Nesari. Dr. Manoj has 20 years of outstanding experience as an Ayurveda clinician, during which time he developed expertise in Ayurvedic management of pain, dominant conditions such as spinal degenerative diseases. His contribution towards development of Ayush sector has been in areas such as policy and planning for matters pertaining to Ayurveda education, practices and research capacity building of stakeholders, development of new courses, regulations, research plans, various schemes for promoting different sectors in Ayush, etc. He has represented the Department of Ayush in various committees, meetings, discussions and negotiations with different ministries of Government of India, national as well as international regulatory authorities and organizations. Dr. Manoj will address us on the topic, Modern Advancements in Ayurveda, Ayurgenomics. Over to Dr. Manoj.
Thank you very much to all of you for inviting me over here, and especially my friend Dr. George Bera, who took the initiative to invite me, and also to Swamiji for organizing this conference probably for the first time, and I believe that this will continue in future as well. We just heard the Secretary Vedya Rajesh Kotecha, who couldn't be here because of his very important meetings over there. Otherwise, we would have really loved to be here, and we would have loved to listen him in person. So my friend Secretary Vedya Rajesh Kotecha, Professor Meeta Kotecha, the Vice Chancellor of the National Institute of Ayurveda, Jaipur, Dr. George Bera, Professor Tanuja Nesri, who will be joining online. She is the Director of All India Institute of Ayurveda. All my colleagues who had joined in the morning from various countries online, those who are present over here. Namaskar to all of you. I'll keep this talk very simple. This is very technical, but still I will try to make it very simple so that all of you, whether you have the background of Ayurveda, or whether you have the background of the Vedic sciences, or whether you have the background of the economics, so all of you can understand very easily. And I have modified my topic little bit. Instead of just focusing on the ayurgenomics, I made it Ayurtech. So when we talk about the health issues, in the morning we spoke about how to be healthy. So which are the main issues, and the issues when we are talking at the national level? So majorly they are the infectious diseases, they are the non-communicable diseases. Non-communicable disease means the diabetes, hypertension, cardiovascular diseases, cancer. So these are the non-communicable diseases. Iatrogenic diseases. Iatrogenic diseases means the diseases which are caused by the side effects of the drugs or the medicines. This is a major category nowadays which are being emerging. The malnutrition, and when we say the malnutrition, it is not only the undernutrition, even the overnutrition also. So undernutrition and overnutrition, so that is actually malnutrition. So whether it is the countries of the Southeast Asian countries or the African countries, so they have the problem of the malnutrition. At the same time, on the West, there is the overnutrition, because everybody is popping a lot of pills as a health supplements, and these food supplements, they also cause many problems. Recently, there was a news in the newspaper regarding the side effects of vitamin D, because everybody thinks that the vitamin D is good. So let us have calcium and vitamin D so that my bones, they will be stronger. But it is not. Ultimately, they also cause them side effects. So we have to be very careful. The high infant mortality, especially in the India or in the Southeast Asian region, the high infant mortality means the children under the age of 5. So the mortality in that age group, because in that age group the immunity is still improving, it is not yet fully developed, and that's why the mortality is high. the inadequate safe drinking water. So that is another problem. So whether it is the fluorine in the water in the areas like Rajasthan and other things, or it is the other contaminants, maybe they are because of the pesticides, they are because of the various effluents which are flowed in the river, because they are not treated, and they go in the river, or they go in the soil, and that's how they contaminate the drinking water, and that drinking water, knowingly or unknowingly, we are drinking, and the poor sanitation. So these are the major health issues, and that's why the Prime Minister focused on both the aspects. There is a separate ministry, the Jal Sansadhan Ministry, to focus on the safe drinking water. It is a major issue, and we spoke in the morning that what is there in the universe, yat pindetat brahmande. So the universe within is universe outside, and vice versa. The universe outside is universe within. So if the water outside is not good, and if we are going to have that water, it is going to cause many problems. The same water is being absorbed by the food grains and the various plants and vegetables, and all those pesticides, they are available in those vegetables, and we are eating those vegetables. So indirectly we are consuming all those pesticides, and that is one of the cause for the various diseases, especially the cancer. Now in this, the top is the infectious diseases, and I'll show you few slides about the infectious diseases. And when we talk about the infectious diseases or the various other health issues, so on one side, the knowledge of Ayurveda and the Vedic knowledge, it is important. At the same time, it is also important to substantiate that knowledge with the technology. So both things are required. We should have the knowledge, we should have the wisdom, and that knowledge needs to be supported with the technology. And that's why the Ministry of Ayush took the initiative of Ayurtech. So Ayurtech is combining the technology with Ayurveda, combining the technology with the Veda. So whether it is artificial intelligence, whether it is machine learning, whether it is genomics, whether it is proteomics, whether it is gut microbiome, and the various kind of modern technology which are there. So we have to integrate that in our sciences, in our knowledge system, so that it will be replicated on a very large scale. Because ultimately the scaling up is required. Maybe I am providing treatment to 5 people or 10 people, but that is not sufficient. We have to replicate, because the population of India itself is 130 million. So it's a huge population, and that's why we have to multiply it. And while doing this, we have to focus on the Sustainable Development Goals. Those here on the left side back, so you probably may not know what is mean by Sustainable Development Goals. But then Sustainable Development Goals, they are the various areas which are identified by the United Nations, and they have been adopted by all the countries, including India, and that include the zero hunger, that is food for all, the health and wellness, and the various other. There are different 17 sustainable development goals. And in this particular perspective, we will be talking on 2. And finally, the One Health, which I mentioned in my talk in the morning. And that's why it is important to have the collaboration, because every system or every institute, they will have the expertise in maybe 1 area, 2 area, 3 area, but nobody is complete. And that's what Ayurveda also said, that ekam shastram adhiyano na vidyat shastra nishchayaha. So you have to learn one branch, but at the same time you cannot be expert in all the branches of the knowledge. So you have to collaborate, and that's why the Ministry of Ayush took this initiative to collaborate with the technology institutes. So whether they are the IITs, Indian Institute of Technologies, whether they are the organizations under the Council for Scientific and Industrial Research, in short they are called as CSIR, they are the Department of Biotechnology, and various international research organizations One of that owning by Dr. George Behra. And at the same time, to encourage the startups. Because the startup is a culture that we have to develop. Recently, last week only, 105, 105वां जो startup है, it has gone to the level of the unicorn, 105. So this is a major leap that India has taken, and the ministry is also working on this, developing the startup culture. And for this, the ministry collaborated with the CSIR, and these are the various areas where the ministry collaborated with the CSIR, whether they are the medicinal plant, the agrotechnology, because the agrotechnology is very important when we are talking about the medicinal plants, which is the base for Ayurveda. So in that, we should have the maximum yield of the medicine plants, and that should be sustainable harvesting. Sustainable harvesting means when we actually harvest, जब उसको हम तोड़ लेते हैं, वो तोड़ने के बाद भी कल के लिए, परसों के लिए, 10 साल के बाद में, it should be available for the utilization. So that is sustainable harvesting, and to have the sustainable harvesting, we should have the technology. So this agro-technology, the herbal drug formulation, the drug development is very important, that should be there. The scale-up pilot activities. So these are the various initiatives which are required, and for that the ministry, the National Medicinal Plant Board, it actually collaborated with the CSR institutes, and we developed this agro-techniques. And this is the Golden Triangle project. So Golden Triangle project ministry actually launched long back, and we are again reviving this Golden Triangle project. So this Golden Triangle project, it goes much beyond the ayurgenomics. Ayurgenomics is a very small part of this Golden Triangle. And what is Golden Triangle? So Golden Triangle is actually the sangam of technology with the ancient wisdom. So this is the Golden Triangle project. And the research is on both the ways. On one side, the research is on developing the new medicines, because there are newer and newer diseases which are emerging. Say for example, the COVID-19. The entire universe is suffering with this COVID-19 for last almost 2.5 years. And still we are yet to find a medicine which we can say that this is the medicine which will cure COVID-19. So even after 2 years, we are not able to find a drug for the COVID-19, but at the same time, the Ministry of Ayush, with a lot of research, has developed a drug called as Ayush 64, which is the drug for the COVID. To treat the cases of mild to moderate COVID conditions, the Ayush 64, the Sanchamani Vati, the Anutel, these are the drugs that the ministry has repurposed. Repurpose मतलब कि जो पहले दूसरे किसी डिसीज़ के लिए यूज़ हो रहा था और अभी हमने उसको अब ये इसके लिए यूज़ करना शुरू किया. So that is one aspect of the research, and the another aspect is, एक बार आपके पास medicine है, we know that it works, but then we need to know its mechanism of action. How does it work? And that is called as the reverse pharmacology. So these are the both ways to actually look at it. And with this, when we are working on this COVID-19 for last 2 years, so in this last 2 years, total 146 research the ministry has conducted through these various organizations. And these are prophylactic studies, the therapeutic studies, the observational studies, systematic review, and many more. So one of that is the Ayush 64. So Ayush 64 in the 1980s, it was basically developed by the Research Council for the purpose of malaria. And after this COVID actually emerged, we actually had a gut feeling that probably this medicine will be useful in COVID as well, because as an experience, as a physician, we knew that it is also working on the various viral conditions which are similar to SARS. And since it is also working on the SARS, and the COVID being in the category of the SARS, probably it will work on this COVID as well. And that's how actually we started working on it, and we found that the Ayush 64, it really works on this COVID-19. And then the rest of the history actually, and then there's a lot of research that we conducted on the Ayush 64. So there are a number of clinical trials also we conducted. The another medicine is the ashwagandha, and ashwagandha also. So the lot of research is conducted on the prophylactic, because when the COVID is there, so how to protect ourselves from the COVID. And you will be happy to know that the India and the Ministry of Ayush is the first ministry and the first country in the world to promote the aspect of improving general immunity to protect ourselves. So India is the leader in this, the Ministry of Ayush is the leader in this, when everyone in the world, they were struggling to find out some vaccine or some medicine. So that time Ministry of Ayush came out with the concept of promoting the general immunity, Vedic Shamatva. So this is actually the theme that ministry actually proposed, and ministry came out with the guidelines, and all the various immunomodulator medicines, the plants, whether it is guduchi, whether it is ashwagandha, so they were used to improve the immunity, the Vedic Shamatva. And once the Vedic Shamatva is good, so having a good Vedic Shamatva is something like you have a very strong defense on your borders, so that there won't be any terrorists which will be actually coming to your country. So that is the Vedic Shamatva, and on that we focused. So ashwagandha is one. At the same time, this one study you will like to know, this is the study which was conducted on the Delhi police. The Delhi police has the force of 80,000 police. It's a huge force, and they were actually the front warriors. They were the front service providers. They were exposed to COVID, and that time there was no vaccine. And here these are the two different graphs on the general population. You can see that on the left side it is almost 4,000. So, and on the lower, the Delhi police, it is just 60. So this was actually infection rate at that time. So those Delhi population, those who were provided the support of the Ayurvedic medicines, so just 30 or 40% of the 30 or 40 police, they were getting infected every day, whereas in the general population, it was much more higher. And similarly, the Guduchi Ghanvati, we also conducted research on this, and in this we found that the Guduchi, that is the Tinus paracordifolia, it is very, very highly effective medicine for COVID conditions, for all the infectious diseases. And not only that, the Tinus paracordifolia is hepatoprotective. It protects your liver. So this is a very important drug. So there were various prophylactic studies, as well as there were various treatment studies which were conducted. And based on this clinical evidence, we also conducted that how actually it works at the molecular level. So the in silico evaluation it was done, and in silico evaluation also it was found that the various phytochemicals which are there. So the Ayush 64, it contains 36 phytochemicals. So out of 36 phytochemicals, 35 phytochemicals, they had the capacity to bind with the COVID virus. So this is the great finding that we had, and this was the molecular docking it was done. And at the same time, in the hamster rat, in the hamster model, in collaboration with the Department of Biotechnology, we also conducted research on one formulation called as Anutel. Anutel is a nasal administration. It is an oil which is to be applied in the nose. And when this study was conducted on this hamster model, so it showed that because in the hamster model, it is well recorded that when the hamster it gets infected with the COVID, so there is weight loss, there is infection in the lungs, so lungs they are compromised, and there is a lot of splenomegaly. So these are the three things, and when this Anutel, it was administered for 5 days in all these hamster, so those who are from the background of the biotechnology on this side or this side, so they can understand. So when this Anutel was administered, and there were 3 groups. One group it was given the Anutel, another group was given only the sesame oil or til tel, that is called a gingerly oil, and the third group it was a control group, so there was no any medicine which was given to those rats, and the another was given the standard medicine. So these are the 4 actually the groups of the hamster, and these are the Syrian golden hamster which were used. And in that, we found that there was no significant weight loss in those animals which were given the anu tel. On the sacrifice also, it was found that the lungs which were of the group who had undergone this anu tel, so they were protected significantly. So there was no any gross damage in the lungs. So their lungs, they were protected, and there was no any significant splenomegaly as well. So Anutel works not only as a barrier at the local level, so it works at the different levels. And this is another the study which was conducted on the Ayush Kada. All of you know that Ayush Kada was there, and many of you must have used the Ayush Kada. And this Ayush Kada, this study it was done, and this Ayush Kada, again this docking study it was done, and in this docking study it was found that there are top 12 phytochemicals and the native ligand in 3 against the SARS-CoV-2. So they were found that it contains the somnifera A, the tinosporoid, the ethinocorticide. So these are all the flavanol, these are the various phytochemicals in the medicinal plants which had the capacity to work on this COVID. And these are the different targets. So these are the 7 different targets. So this Ayush Kada not only works at one level, it works at these 7 different levels. So it is very, very effective in protecting this, and I am really very happy to share with you that this Ayush Kada was not only used extensively in India, but my friends in Brazil, they also mentioned that the Ayush Kada was used extensively in Brazil to the extent that the Kada was not available in Brazil. So the Ayush Kada has been used in Brazil, it was used in Mauritius, it was used in Nepal and Sri Lanka and many more countries. I don't know how far it was used in Argentina, and probably Dr. Bera will be able to tell us whether the Ayush Kada was popular in Argentina or not. So this is regarding the Ayush Kada. So I will rush through this presentation. And then the impact of the Ayush Advisory. The Ayush Advisory was issued for this COVID, and the more than 1 million people, they actually responded on that, and they actually reported 89% they reported that they have benefited of this. And this is one more medicinal plant, it is called as the Patal Garudi, and this is found in useful in dengue and the COVID-19 as well, because dengue is very also common. And now coming to the Prakriti, because we know that all the individuals, they are not same. Everybody has some different liking, they have different Prakriti, they have the different constitution. And this is what actually Ayurveda says, that Swasthasya Prakriti Bhedan Nana Prakaraha. So though we are healthy, but all healthy, they are not equal, they are different people. So some may like the sweet, some may not like sweet, some may be able to tolerate some kind of exertion, some may not be able to tolerate that. Some may like to have the cold weather, some may actually sustain that. Now here also we see that some of you are actually feeling a lot of heat, and some of you are really comfortable. So this is the difference in the Prakriti. And this study, it is called as the ayurgenomics. So in collaboration with the CSIR, this 3 sutra, the study was conducted, and in this 3 sutra study, they found that definitely there are certain kind of genes which are more expressed in the particular Vata Prakriti dominant person. There are certain types of genes which are dominated in the Pitta Prakriti person, and there are certain types of genes which are dominated in the Kapha Prakriti person. But this is not only limited, it is also that how the people, they actually respond to the various triggering factors. So some people, they get immediately cold after getting exposed to the cold. Some people, they do not, and that is also related with the Prakriti, and was correlated with the genomics as well. And at the same time, the Prakriti and the cellular variability of proliferation rate. So this was another study was conducted. And one more study, it was conducted based on the ayurgenomics, on the evidence-based usage of the Ayurveda formulations. So different Ayurveda formulations, so how they actually impact every individual, so at the genomic level. So this was another study which was conducted. So likewise, there were different studies which were conducted And for this, we have collaborated with the IIT Jodhpur. And IIT Jodhpur, we are working on the artificial intelligence, the data science, so various aspects of the AI also. So it is the phytochemistry, it is the physics, it is the artificial intelligence, it is the mathematics, it is the NPL, that is the national the processing of the languages. So all these various the technologies we are working together, and this concept is called as the Ayurtech, and now we are also working with in collaboration with the IIT Madras also. And when we are talking about the non-communicable diseases, so this intervention has to be very low cost. And for this, the ministry has developed various low-cost intervention to counteract the non-communicable diseases. Whether it is diabetes, there are many the research which has been done on the diabetes, whether it is on the level of the genomics, whether it is on the level of the clinical trials. The third part is the pharmacovigilance, because as I mentioned that if you take too many of vitamins, even that can be toxic. So when you take the Ayurvedic medicines, whether they are really safe, even after consuming for a longer time, so ministry has launched this program. It is called as the pharmacovigilance, and this is also mentioned in Ayurveda that if you take the nectar or the amrut also in excess quantity, so amrut may also cause you harm. And we are working in collaboration with the WHO as well. And this is the spectrum of the evidence-based, so whether it is the scripture evidence, the experience-based, the long-standing use, the mass acceptability. So the evidence which is mentioned in the Vedas, it is also an evidence, and that's what actually we talk in the morning, in the evidence, and that we have to bring in the forth. And this is very important, that in spite of the fact that ancient Hindu medicine practice in India in the earliest time was an equally developed scientific discipline as any other contemporary system in the world, its influence on the Western society was small. Hence, most of the current writing in the history of medicine do not have an appropriate mention of the contribution of ancient Indian medicine. And this is mentioned by Welch, who is an Westerner, in 1968, not today. And this is the fact that we never actually approached to the West, we never actually told them, and we never had this thought of patenting, IPR. So we never had this thought of patenting, that this is mine, and if you want to do this, then you have to pay me money. So this thought the India never had. India always said that Vasudhaiva Kutumbakam, the whole universe is one family. So this knowledge is for everybody, so use it. And there are many others who actually pirated this knowledge on their name. And that's why the name of India is not seen in many of the literature, but then we have to reverse it, we have to work more on that, and we have to prove that what are the various initiatives that the India had taken in the past and now as well. And this is the WHO perspective of the global evidence. I want to go into the details of it. So the research initiative in science, in Ayurveda, and the Ayurveda biology, these are the initiatives that the Ministry of Ayush has taken. So health is the foundation of the prosperity and contribution to social stability. These are assets in every country, and they strengthen our collective security as an international community. So this is a statement of DGWHO, and the same is there in Charak Samhita, which was mentioned thousands of years back. Health is the foundation for all humanly duties, that is individual duties to society, economy, procreation and recreation, as well as the emancipation. So this is mentioned by the Charak Samhita, and the similar is now actually being said by the DGWHO. So this is the great knowledge that we have, and we have to promote it more and more. We have to study it hard, and we have to develop the evidence. I will stop over here because the time is, there are many things that I can share with you, but I will stop over here. Thank you very much.
Thank you, Dr. Manoj. Our next speaker is Dr. Manojji's better half, Professor Dr. Tanuja Nesri. She completed her MD and PhD in Ayurvedic Pharmacology, Dravya Guna Vidyan from Gujarat Ayurveda University in Jamnagar. Currently, she is working as director as well as head division of Translational Research and Biostatic at All India Institute of Ayurveda, New Delhi. She is also a chair for Healthcare Sector Skill Council for the Ministry of Ayush. She has worked as CEO of National Medicinal Plants Board at the Ministry of Ayush. She is a university-approved Ayurveda professor with more than 29 years of experience of teaching in Dravya Guna and Rasa Shastra and research in quality, safety and efficacy of medicinal plants. Dr. Tanuja also very much wanted to be here with us today. She's, however, traveling on a WHO task force duty and has very kindly agreed to address us all virtually. She will speak to us on the topic tertiary care management through the holistic and integrated approach of Ayurveda. Over to you, ma'am.
Namaste, pranam to everyone. At the outset, I'm really honored and blessed to have allowed me to speak online at before esteemed audience and the opportunity to be given by Sri Sathya Sai University, the Swamiji and all the organizers. I pay my respect and I'm really honored, and I say thank you to Dr. George Bera, because of whose insistence I am here, and Secretary Ayush Vaidya Rajesh Koteja, and the co-panelist Dr. Meeta Koteja and the Manoj Nesri, and all the learned and audience and the enthusiastic students. I just take this opportunity. May I share my presentation, please? Yeah. Can I share? I just want to share my presentation. No. Okay. Can you see the presentation? Hello? Can you see the presentation? Hello?
Yes, perfect, Dr. Tanuja.
Is it visual now?
Yes, we can see.
Okay, thank you. So this is a tertiary care management through holistic and integrated approach of Ayurveda. So let me share that the Ayurveda itself, since beginning, since Veda, it is a Upaveda of Atharva Veda, but since beginning it is integrated and holistic. Holistic in the sense it creates the balance and harmony between mind, body, and soul, and also with the external environment, and that sustainable harmony with the mother nature and environment. It makes it as a holistic and integrated with the tradition, supported with the technology. My next slide, please. Yeah. So if we look at the WHO's recent data, even with the 170 member state, because I also have the opportunity to visit and accompany with the WHO GCTM task force at Jamnagar. So WHO has 170 member states, and the data says that, the report says that around 80% of the world population is estimated to use the traditional medicine. So this is something we really have to, that's really the one we really have to do, where this 170 countries which we are using, and 80% population using traditional medicine, that whether that is a primary care or it is in the mainstream of the medicine. So that's the thing. So the overview says that there was a study, and it says that the some countries it is there is a policy in place, some countries there is a regulation, and in some countries there is a practitioners regulation. There are some of the in some of the countries it is just the practice and the products, but as a healthcare system. In very few countries, it is like the in India, in China, in Korea, it is like the separate ministry and a parallel healthcare system. That's what it is in the place. So this, and then when we say that there is an integration which is really needed. So integration, when we say that the integration, and it is said that it is integration with the conventional medical system, that's the allopathy, Western medicine with the Eastern medicine. But the integration is with the technology, like we use the traditional medicine like the Ayurveda, yoga as a holistic in its nature, but the diagnostic uh, criteria, the radiology, diagnostic methods, hematology, biochemistry, and biotechnology, others can also be integrated in the as a diagnostic and the outcome measure. But in some countries, and in many countries, like in India also and many other countries, there are parallel systems. It is a people's choice. The decision for the integration is driven by the consumer. And in India, fortunately, even our the students, they will, if the question is asked to the youngsters, they will say that for the chronic disease, they will go to the traditional medicine, Ayurveda, Unani, Siddha, homeopathy. And for the acute conditions, they will immediately go to the allopathy, the uh, quick fix, we can say. But the COVID has really taught us the lesson that not only for the non-communicable diseases, but as Dr. Mesri mentioned about, even for the communicable diseases, even as a first line of treatment is the traditional medicine. As the app, a Sanjeevani app, what ministry developed, the survey said that 80% of the population, not 80, 87% of the population, they really have used the traditional medicine. But this is one parallel stream. But there is a confluence in many of the European countries, and I'm sure Dr. Bera also, it is the confluence because it is integration is driven not by the patient but the health system, the doctors, because already registered medical practitioners, they have the capacity building. They use the Ayurveda and the traditional medicine as an add-on and value addition as a complementing to their own system, and that is the integration. So it is not the mixopathy, but co-location and the mixopathy. But I think the future of the medicine either is a no medicine if we practice lifestyle, diet, yoga, proper thought process, and sleep, work-life balance, then no medicine would be required. But if at all COVID-like condition and in many cancer to common cold, the patients are consuming, taking both the things. Sometimes they take Ayurveda, sometimes they take allopathy. So one patient is taking many things, but there is no standard treatment protocol for the integration, and the future of the medicine is integration. So we really, that there is a time to think on and developing the integrated protocol. That's what at All India Institute of Ayurveda and Ministry is also working. Even the Niti Aayog is also working on developing the integrated protocol. And I just would like to say that Ayurveda, as it is mentioned, that it is not a science. It is, as everybody mentioned, that it is the not science, but the knowledge system of health and happiness. Hita hitam sukham dukkham ayus tasya hita hitam. So it gives the from illness the journey goes to wellness, but more than that, the journey ends to the happiness. So the ultimate goal and the aim of this knowledge system is to give healthy and happy life, and that's the added advantage. And this is the way of leading healthy and happy life. If someone really wants to excel in their own career, as a student, as a professional, as an academician, as a researcher, then they really have to adopt Ayurveda appropriate behavior. That means a good lifestyle, good diet, then have to know what their temperament is, what their prototype Prakruti is, Vata, Pitta, Kapha, and they have to customize, know yourself, which is a good diet, which is good diet lifestyle, so that healthy mind, healthy body, and there is a healthy mind. So for the healthy mind, really, we have to we really have to practice this healthy and happy lifestyle. That's the way of Ayurveda. And this is not only the folklore medicine, this is a monumental contribution of the India to the world. This is a soft power of India and the greatest gift to the entire humanity. And Charak, Sushrut, Vagbud, they are the three basic treatises where the knowledge, treasure of this knowledge, and there are more than thousands of books where this knowledge is classical wisdom. And now we want to make it as a contemporary because it is already divided into 8 branches and in Hetulinga and Aushad. But what we say, it is a classical yet contemporary and tradition which is supported with the technology. And I'm really happy that the technology students, they are now taking the interest and they have this ownership about our own tradition, which is the treasure of the knowledge. And we are sitting on the gold mine of this traditional wisdom, we can say. And you can see that the WHO DG, Honorable Director General Tedros Adhanom Ghebreyesus, he had visited to All India Institute of Ayurveda, where there is a confluence and there is an integration of tradition and technology, and holistic integrated protocol is being practiced in 30 specialty. Not only diabetes, musculoskeletal, but mother, child, ENT, ophthalmology, and many other diseases. And at the Ahmedabad, there was a global summit where the innovation and entrepreneurship was being discussed, and 167 startup challenges were uh, showcased, and best two had been awarded none other than our Honorable Prime Minister. And we had an opportunity to sign MOU in front of Honorable Prime Minister with Brazil and many other neighbor countries like Canada. And I'm really happy to share that All India Institute of Ayurveda, which is the dream project of Ministry of Ayush, is now expanding its arm as a satellite center at Goa, as an integration. And I'm really happy to share that there are two models of integration at All India Institute of Ayurveda. There is a allopathy is being integrated with Ayurveda and yoga as a 90%. But we have in the medical institution like Sabdarjung Hospital, where 90% is allopathy, and we have practiced Ayurveda as a 5%. So two best model of integrations, Ayurveda integrated with allopathy and allopathy integrated with Ayurveda. Both are people centric, patient centric, and need of an hour, and can be useful in different set of the conditions. And these are the various programs what we are running, not only MD, PhD, but the skill development program, which is very important for the youth. As my friend Meeta will share on that, it is Panchakarma, diet, yoga, cosmetics, and many other. And I'm really happy to share that we have more than 44 MOUs, national and international, and we look forward to sign MOU with many other countries, Argentina and many other, to develop the practice-based evidence and the integrated and holistic practice for the in the interest of humanity. Yeah, I don't know. I just would like to share in quick few slides that All India Institute, even though it is Ayurveda, but it is all supported with all technological interventions for the diagnosis, radiology, CT, MRI, and all. And also we have the patient education cell, because the patient, the people, if they are aware about their participation in following diet, lifestyle, and then it is a patient participation and nursing care, and they everyone should have the better understanding, capacity building. So we have the patient education cell, nursing cell, and more importantly, what if we really have to develop the integrated protocol, even though 90% Ayurveda, but 5 to 10% allopathy, then the skilling is very important to all our scholars, to all our doctors and the nursing and the technician. We train them with the how to use the technology and what is ALS, BLS, emergency management, and that's how each and every patient is being. During COVID also, we have created the success model with the holistic and the integrated practice. not only COVID, we have the integrated oncology for the cancer management, for the orthopedic, that is for the rheumatology, joint disorder. We can have the integration with the dentistry, with the emergency management, dietetics. We have the lifestyle and counseling cell. Even though any person who is practicing whichever medicine, but if we understand what is a good diet and lifestyle, I think if we that integrate and complement, that's I think it is a value addition to the existing. So we have integration with the children, with the mother, with the ENT ophthalmology. And during COVID, we had a COVID testing center, we have COVID vaccination center and all. And this is sort of the central investigation facility. So each and every patient, even though treated with Ayurveda, is being investigated with all latest technology so that the objective markers, even anyone wants to know what exactly is the effect on their organs, on the respiratory, if it is bronchial asthma, then we can showcase that this system as a holistic with diet, lifestyle, panchakarma, and in internal medication has this effect as a whole system, as a black box design. And yes, and coming to the approach, how this integrated protocol is to be developed. If anyone wants to do the integration with two systems together, then there are two approaches. One is an alternate approach, and that's the co-location in one polyclinic or in system. There are two doctors sitting together. They assess as we are doing in Sabdarjung hospital. And when the patient comes, then we understand that in this condition, uh, first allopathy is used or first Ayurveda use, or patient has a choice to use the go to the alternate medicine. So that's the alternate approach. And the protocol is also developed for that in the cancer management. But there is a complementary approach also. Well, first is a cafeteria and the second is a complementary. So in the existing treatment, we add on diet, lifestyle, panchakarma and all, so that gives the value addition. And I think that's the way. And how's the process? What we do, we identify the priority areas like cancer, COVID and others, then collecting the information, bringing all the experts together, then the practice-based evidence, whoever is doing, and then let's prepare the algorithm. And I'm really very happy to share that we have submitted such algorithm to Niti Aayog through the working group, through ministry. And in almost 19 conditions, we have those algorithms ready for the practice-based integration, which gives the better outcome. I think we will be able to catch, page more Nobel Prizes if we really integrate our traditional wisdom into the mainstream medicine. For example, for the children, in the malnutrition, green is the traditional medicine like Ayurveda, and the other is integration, and the standalone allopathy is this one. So we say that mild conditions standalone Ayush, in moderate conditions of the malnutrition, this can be together, and in the severe conditions of the malnutrition can be the conventional medicine. So these algorithms, and even with what detail also has been planned, and that's what we say that the integration of the West and East holistic is with Ayurveda, yoga, meditation, and with the sustainable harmony with the environment. I think that's what it's deeply rooted in our tradition can be done. And now this is one example of the diabetes mellitus. We have 42 patients data where we have the integrated model. Patients are on anti metformin oral hypoglycemic, but we have added Ayurveda medicine. And you can see even HbA1c, the parameter which is a gold standard for the diabetes, from 11 it has gone to 6, 5 within the normal limit with the intervention of the Ayurveda. And this is one example, Dr. George Vera, because you are also the specialist in that. The cerebral palsy is the one strength area, degenerative and neurological disorders. And you can see, we can really, that it is the healthy and happy life. We can bring the smile on this patient and also to the parents also before and after. He's not able to even sit and now is sitting, and this patient is now smiling. And this is what when you with the WHODG with all those traditional therapies, Shalisha stick Pindasved and what others. And not only this area, this is integrative dentistry, where this repair can be done by using integrated approach. And you can see the other conditions like in ICU. We have the ICU, intensive care unit, where the monitor is there, critical management, intensivist is there. So starting from chronic kidney disorder to many other conditions, we can really treat them with the holistic approach. And even ophthalmology, retinitis pigmentosa, and optic atrophy. And because of the IT, we have many conditions we can really treat. And now, because of a lot of pollution and allergy, respiratory diseases, we have now data 1,500 patients where we can, with the integration, we have developed herbal aerosols, and with the integration, we can really help them with a better outcome, and where with the spirometry and with peak flow meter, we can do. As Dr. Nesri has already mentioned about COVID-19, we had the promotion and capacity building was the first level. Then was the practice, and All India Institute was the first one where we set up a holistic integrated model. But one more important, we have to say that let us practice before you preach. So all our healthcare workers and the doctors, they started doing yoga. They were mentally stable. And I must tell you that our harmony, integration with the mind, body, and spirit, soul. So if we are mentally strong, because immunomodulators make you strong, not only physically, but mentally also, then it is really useful. And that's what we do. And we had the Homa, Havana, and the model was Ayurveda, yoga, meditation, recreation, and supported with some of the for the Panchakarma. These are the live photo pictures from All India Institute. And this holistic and integrated model with outcome measures was 94% with standalone holistic Ayurveda got completely cured, positive to negative, and rest of also cured with the integrated model. And Delhi police already mentioned, so I'll not go into that. But I'm really very happy because the end of what we do now, it is from practice-based evidence to the evidence-based practices. So the publications are more important during COVID, and our Ayu Raksha is been published in the Frontiers of the Public Health, where impact factor is 5.9 2 days back. And lastly, to all young dear friends, if we really start doing startup in Ayurveda, in yoga, I think ocean is the opportunity and the sky is the limit, because you can see during this investment summit, uh, because of the startup, this is a young girl who has developed IT solutions for the quick fix with the Ayurveda diagnostics and the Nadi. She was awarded by none another than the Prime Minister. I think this is the story where we can really develop more and more unicorns and the entrepreneurship through this Ayush investment. But future is integration, and I think that's the way we have to go ahead for the entrepreneurship. Thank you very much for giving me this million opportunity. Thank you, one and all.
Thank you, Dr. Tanuja ji. It was really an honor to have you join us virtually and to listen to you. Our next speaker, Dr. Manoj, has a flight to catch and has requested to take leave. Before that, we would like to extend a token of our appreciation to Dr. Manoj ji. We would like to call upon Dr. Naveen Bhatt, Head of Department, Sanskrit and Vedic Studies, Sri Sathya Sai University for Human Excellence, to kindly hand over the memento. We would also like to hand over the token for his wife, Dr. Tanuja ji's memento. Request Dr. Manoj to collect it on his wife's behalf. Thank you both, sir and ma'am.
I want to express gratitude to Dr. Muddenehalli. He is involved in one session of the National Parliament of India. That's the reason that he, in less than 1 hour and a half, he has a flight to Delhi. Thanks so much for being here and for your effort to share your experience. Really, thank you. And also thank you to Dr. Tanuja.
Our next speaker is Professor Dr. Mita Kotecha. She obtained her MD Ayurveda in Dravyaguna from Gujarat Ayurveda University and her PhD of Ayurveda from Dr. Sarvepalli Radhakrishnan Rajasthan Ayurveda University at Jodhpur. Currently, she serves as professor and head of Dravyaguna department at the National Institute of Ayurveda in Jaipur. Her professional career is dedicated to herbal medicine, and this has been her area of interest for teaching and training since 1991. Dr. Kotecha is also chairman and member of a number of committees including Ayush, NIA and Rajasthan Ayurveda University. Today, she will address us on the topic Scientific Importance of Plants Used in Rituals from Vedic Era. Dr. Kotecha ji.
Namaskar, dignitaries on the dais, off the dais, and all audiences, so many students. My namaskar to all, and Swamiji also, my namaskar. And I am very grateful and honored Swamiji invite me here, and I have a chance to come here in ashram. So I feel very honored. So today's my topic is scientific importance of plants used in ritual from Vedic era. We are using so many plants as a worship and ritual procedures. So, but why we are using and why those plants? Because so many plants are there, but some typical plants are given in Vedas for ritual procedures. So why this? So behind this, what is the scientific importance or scientific reasons? So I will try to explain this. All know that 4 Vedas are there: Rig Veda, Yajurveda, Samveda and Atharva Veda, and Ayurveda is the Upaveda of Atharva Veda. Right? So, and Veda mentions so many plants in Veda, description of so many plants are there. And in Vedas, Yajna, Havana explained, and so many plants are used in this Havan also. So first I explain this Havan, plants of Havan. From centuries, we are doing Havan in so many rituals. And so even our Solah Sanskar in India, so all Sanskars having also Havana. So Havan is so much important, and it is socio-culture force in India. And Havan is balance the 5 major elements, Panch Mahabhut, affording sunshine and rain in reasonable measures, resulting in proper growth of crop and plenty of food. But nowadays we are not following anything, and environment is very much disturbed. So there is no proper rain, no proper sunshine, and no proper growth of crop and food. So it is so much important to save these all things and follow these all things. These all rituals are not only scared, because also practically useful for mankind. These all rituals are very useful, and all rituals having some importance and some reasons behind this. So yajna is get strength, longevity and vitality through the burning of herbs with ghee for long duration. This is importance of yajna. And yajna means to give, to unify, to worship. So all in Vedas and Bhagavad Gitas and Mahabharata, Ramayana, all are described the yajnas, different type of yajna. So are combined to achieve desired physical, psychological and spiritual benefits. And especially Ayurveda says that yajna means, in Ayurveda they describe the yajna for mental health. So in so many mental problems, Ayurveda describe yajna. So it is very important for psychological health. And fumigation of different substance means like different medicines and wood and ghee and anna also means java and etc. So mainly two basic energy system in yajna, it is heat and sound. Both are important, and the effect of this is psychosomatic disorder, effective against varieties of physical and psychiatric diseases. I already told that. Excellent process of environment purification. It is very important for this. It is scientific importance and beneficial effects. Havan is an ancient ritual which is performed to purify the atmosphere and the environment. Havan is the Sanskrit word which reflects to many rituals that involves making offering into the concentrated fire. And you know this Havan, herbs used in Havan for main, wood for main yajna fire, aromatic herbs for offering to the fire, medicinal herb and other substance offering in the fire. So wood for yajna, chandana, agru, tagara, devdaru, amra, palash, bilva, ashwatha, vata, shami, udumpar, khadir, madhuka. This is the plant's photograph of this. Aromatic plant, keshara, kasturi, agaru, tagara, chandana, ela, javantri, kapur, etc. And medicinal herbs, guduchi, brahmi, shankpushpi, nakkesar, yashti madhu, raktachandan, bibhitaki, sunthi, haritaki, shati, gugulu, mustaka, jatamansi. These all herbs are used in Havana, yajna, and other substance, ghee, sugar, honey, wheat, rice, yava, til, draksha, and dry dates. So, yajna can have health benefits on different level, environment level, personal level, physical level, mental level and spiritual level. Other so many drugs also scientifically established activity against microorganism like Havana, and Havana the prescribed medicinal plants or plants are useful to microorganism, and these another plants also used for this. It is scientifically proved, different researches are there. And there is active components of these plants and how it is affected, but it takes so much time, so I'm not explain now. Effect of yagna on environment. Removal of foul odor, removal of bacteria and virus, removal of insects, improvement of plant lives, and beneficial effect of CO2, carbon dioxide. So, burning of wood on other organic matters flame leads generate to CO and CO2. Controversial as potential increase in greenhouse effect, and actually it is not only CO2, it's a CO2 cycle, improve the CO2 cycle, and its cycle is improve our environment, our surroundings in the environment. That's why it is important. And it's a research by Dr. L. Melia from Poland. Another, so many effects of yagya on personal health also, means improve the respiratory functions and cleansing our body channels because we inhale these fumes of yagya. So, and antimicrobial, antiviral, and antibacterial, so many effects. It is improvement of skin health also. So, another some important plant, I am explaining the plant. First is Ashwatha, all are knowing, Pippala. People is symbol of Lord Vishnu also, and you know there's Gautam Buddha worship in under the people plant. So in Ayurveda also, because it is medicinal plant also, and Ayurveda describes so many properties of this Pippala, like Vani, Rakta Vikar, skin, in this skin disease, it is good for skin health. It is stop the bleeding and anti-inflammatory. It is joint the bone, etc. So many properties in Ayurveda described for people. And another activities is research says that antimicrobial activity, wound healing, dermatoprotective effect, anti-ulcer, antioxidant activity, so many activities are there. And you know that people is giving oxygen for 24 hours continuous. And that's why people is used in so many rituals because it is very good for mankind. It's give day and night oxygen continuously, improve soil, it's balance the climate, control the soil erosion. So many benefits are there, and Rigveda also says that vegetative from the dhanya varga means it's improve fertility of soil, and dhanya means dhan, food substance are grown very well due to people. And it's absorb excessive heat from sun and collect and hold water contents. So that's why it is very important, and it is written in Rigveda also. Second is Vata. Vata is Mahavruksha and also national tree of India. So Vata also in Ayurveda is very useful. The latex of Vata, the branches of Vata, leaf of Vata, all are used in our medicinal use. It is Da means burning sensation, Varnyo, for skin health, and Amati means dysentery, etc. It is work on these diseases also. And it is checks the environmental pollution. And on Vata, Laksha is grown. And Laksha is having so many medicinal properties, and it is very useful for medicine. In Rigveda, Atharvaveda and Rigveda, they says that it is grahana dharti means prithvi को ग्रहण करता है, means it's doing soil conservation and erosion of stop the erosion of soil. It is grahana shakti is there in Vata. And another is in summer it's means a surrounding of Vata and under the Vata. In summer it is cool, and in winter it is hot. This is the speciality of Vata Vriksha. And that's why I think in our India, every village have Vata in the between the villages, and there is sitting area also around the Vata. Tulsi means you can't compare with anyone. तुलसी जिसकी तुलना किसी से नहीं हो सकती वो है तुलसी. So tulsi is so important and queen of herb. It is miracle. So many uses of tulsi is there. And it is actually when you plant the tulsi, the almost 30 feet area of our tulsi is clear the environment, and there is no chance of any insects or mosquitoes or anything. That's why this is also tradition to plant tulsi in between the home. So it is also scientific because it's prevent environment and it's prevent your health. And in so many diseases, tulsi is used. All are knowing that tulsi is medicinal property. That's why I'm not explaining this. So tulsi is incomparable. I told you that tulsi जिसकी तुलना किसी से नहीं होती. And it is antiviral, and it is effective on active virus also. So that's why in viral diseases, use of tulsi is very important. Gugulu, it is used in Havana, and it is antimicrobial activity, anti-inflammatory, antibacterial activities, so many activities, and protect from Rakshasa. Rakshasa means bacteria, virus, fungal, microbes. So in Vedas they said that it is protect from virus. Amra, the fruit of palm is used, and flowers and leaf. These all are used very well, and wood of amra is used in Havana also. But the flowers of amra is when it's dropped, so then you can imagine that now Varsha Rutu is coming and rain is coming like this. And ama fruits are very important to enhance fertility. So it is soil fertility also, and it is for this all insects and animals, and there also fertility improved by Ama. Udumbar. Udumbar is mentioned in all sanskar and all Havana. Udumbar is there because it is most important plant. So it is used in all rituals. It is also antibacterial, antifungal activity, antioxidant activity, and it is described in Rigveda as a kalpataru, purify the climate. And that's why it used in Havana from in all sanskara, and prevent kshaya. Kshaya means किसी भी चीज़ की कमी होती है, उसको क्षय को रोकता है। तो वो चाहे वो मिट्टी की कमी है तो भी क्षय को रोकता है, और शरीर में कोई कमी हो रही है उस क्षय को भी रोकता है। सो इट्स प्रिवेंट क्षय। दुर्वा is also used in worship and puja everywhere, and durva is very good as a medicine property also. It is good for skin health, and it's stop the bleeding anywhere is there. And durva is actually regenerate. So any part of body is destroy or degenerate, then if you use durva is regenerate this part. So durva is very, very important as a medicinal property. So high potency of regenerate organs, mean any organ are destroyed, then durva is regenerate this. And durva is grown anywhere in any soil, and it's stop the soil erosion and enhance the stability, etc. This is research says that antimicrobial, anti-parasitic, insecticidal and repellent, एंटीऑक्सीडेंट, इम्यूनोमोड्यूलेटर, मैंने बहुत सारी एक्टिविटी है। एनाल्जेसिक, दर्भ इज considered to be holy and best medicine in Atharvaveda. This is also research on darbha. Palasha, Kimshuk or Palasha, both name is, and it is Butea monospora, means beautiful flowers are there, and it's on very good. This is also used as a medicine in so many diseases in Ayurveda, and it is regenerative. It is also purify the climate, prevent the premature decay, and so many things, and it is antimicrobial, mean it is also clear the environment. Bilva, you know, Bilva is very good. It is holy, and Bilva leaf we offer to Shivji, because Bilva leaf is very good regenerative also, anti-inflammatory also, and anti-diabetic also. That's why I think this tradition to chew this Bilva leaf, and antioxidant, antipyretic, anti-inflammatory, high antibacterial activities are there, and all part of Bilva are used in medicine. Shami is the holy plant, and actually whenever this starving means sukha ho jata hai, when no rain and nothing to eat food, then you can save your life with only shami, because shami fruits having protein and carbohydrates and calcium and phosphorus and potassium, means all things are there. So it is a very useful plant, shami. And another so many medicinal use also there, and environmental clearance also it's doing. But this is different from other plants. It's because it's having nutritional value, so much nutritional value. Ashoka or shok means it's remove the shock from body, it's remove the stress and tension, and that's why Ravan put Sita Maya in Ashok Vana because she is on stress, and for distress he put in this. So pacify the all sorrows, mood elevator. Panga, Pondrik, Khadira, etc. Vedic era defines the treatment of excessive range of diseases and ailments through yajna, along with precautions, detailed procedures, cause of disease, treatment, supplements, etc. Our ancient Vedic literature incorporated spirituality with science. Sanatana Dharma has its foundation upon scientifically inquiring into matter of spirituality. It is the essence understanding the law that govern anything. Trees and plants have always been divine source of humankind. Our ancestors have recognized their scaredness and passed the notion down to every generation. In many mantras and mantras of hymns of Atharva Veda, Agni, Surya, Vacha, Gugulu, like many medicines are described as Krimigna. Krimigna means antimicrobial. In Vedic era, spiritual trees were used for environmental protection to promote plant cultivation, preservation, conservation, and also medicinal properties. The practice of ritual is a part of great Vedic culture, and it showers multiple benefits in protecting human health and environment. A lot of pharmacological and environmental purification work has been scientifically carried out in various parts of India. Recently, during COVID time, Aparajita Dhuma Churna fumigations has shown promising result in antimicrobial activity. Scientific evidence has shown that the medicinal plants being used in Havan, owning their chemical moiety and the process through which enters in the body makes an effective process for virus, CNS related problems like epilepsy, anxiety, etc. Thanks very much to listen to me. Namaskar.
Thank you, Dr. Mithaji. Our last speaker is Dr. Jorge Luis Berra, an Argentinian medical doctor, MD in Pediatrics and Family Medicine, and honorary professor at the Universidad del Gran Rosario in Argentina. He has participated as an invited expert by the WHO Organization and the Ministry of Ayush of India to write the benchmarks for the teaching and practice of Ayurveda and Panchakarma. He will be addressing us on the topic Concepts of Ayurvedic Science and Ayurvedic Practices.
Thank you. I have 6 minutes. Then it will be Formula One race. Maybe some of you are asking why a foreigner is speaking here about Ayurveda in India. And the real reason is that I want to express gratitude to India for compiling Ayurveda, for protecting Ayurveda, for progressing Ayurveda, and most important of all, in these current times, for sharing Ayurveda all over the world. For this, thank you, Danevadagalu, Danevadalu, and thank you for all. I'm coming from Latin America, 14,000 kilometers from India, almost 20 hours flight at least. And Ayurveda right now is recognized as a system within the national system of health of Brazil, Colombia, Cuba, and Nicaragua. We in Argentina, through the guidance and blessings of Swami Sathya Sai Baba, we were delivered the first PG course on Ayurveda in at the Western state universities. And right now, at this moment, university courses are recognized in Argentina, Colombia, and Brazil also. And I want to share with you that we have a lot of medicinal plants available commonly in India and in Latin America. When I began to study medicine, I have the feeling that at that moment there were something like the Berlin Wall. In one side, very useful treatment, diagnosis procedures, so on. And in the other side, is medicine that could understand the persons. Thank God, when I discovered Ayurveda, I had the opportunity to mix these two sides and progress into the treatment of the patients. I will not speak about definition of Ayurveda. They have been speaking, the previous speakers. But I want to share with you what our doctors in Latin America find when studying Ayurveda. We have been, during these 22 years, Dr. Manoj has shown his better half. Dr. Rajesh has shown his better half. My better half is over there, and we, both of us, share this academic work in Latin America. We have trained more than 6,000 people. 3,000 of them are university health professionals, and at least 2,000 of them are medical doctors. When they are in contact with Ayurveda, they found one complete system of medicine which integrates body, mind, and soul that is allow them to understand the people, allows them to recognize which are the weaknesses and the strengths in the patients and on them also, which offers treatments according in tune with nature, which offers early diagnosis and respectful treatments. And also they realize that there are a system of medicine that instead to oblige the patients to take pill after pill, that there is a system of medicine that could be adapted to the reality of the person in different places and different times, delivering recommendations. Just for all the people that here are related with sports, you likely know this, no pain, no gain. And here in this diapo says, please shut up and train. That's the common way of training in the sports area. And Ayurveda has a totally different approach. And I want to share that this approach has been involved with more than 10,000 high competition athletes, Olympic teams, and which these Ayurvedic programs of sports produce sound effect. We have no time. Please look it into, and you will be looking for very interesting things. To work with the Ayurvedic program for sports, you must know the Prakriti, the body-mind constitution. There were some nutritional recommendations according that Prakriti. There are some pranayama yoga exercises, and also the selection of some exercises. Listen, I'm going to the last part of this picture. When the athletes that are involved in this training program, they obtain the same results that the common training, but it's equivalent to traveling to spending 8 liters in 100 kilometers instead of spending 30 liters in 100 kilometers. And we know, all of us know, if we could spend less, is much better for us. And Martina Navratilova was the best tennis player of the world. He was first tennis player for more than 5 years. And she said, the one thing that those programs, all the programs that she had been involved, had in common is fatigue. I feel good, look good, and everything about me is balanced. The emotional, the mental, and the physical are working in balance after taking this program. And this person, I'm showing you a 2 notes bill in dollars. because this person has been the Secretary of Treasury of USA and also the President of Olympic Olympic Committee of USA. And he said, this revolutionary book will set the pace for all future athletic training and fitness program to come. You have a lot of things to look about that. Some people say that Ayurveda and other traditional systems of medicine, they don't have data. That's not true. Pamphlet is for us, for the medical doctors, this is the Bible, more than 30 million articles in medical areas. And you have here the Ayurvedic term, how many scientific articles are in PubMed, and also this Ayurveda research portal is from Ministry of Ayush, which are compiling other articles. You could see that there are a lot of information about that. Most important thing, in February, the WHO, after 5 years process, I'm very grateful to Swami. I had been one of the experts invited for all the WHO regions to be involved in this process, produces the benchmark for the training and the practice of Ayurveda. The objective is to offer to all the countries that will introduce Ayurveda. And all of us know that our destiny does not relate it only with DNA. And this is the lifestyle guidelines that has requested WHO to the Gujarat Ayurvedic University at that moment in order to know which is offering Ayurveda to have a better life. India has a lot of spicy food. For someone, it's very difficult to cope, but I'm sharing with you one scientific paper, more than 5 lakhs people that has been studied with more than 7 years, and those people that eat spices every single day has a 14 less risk mortality than people who don't eat spices. I will request to have other study if there are so much spices, which will be the effect. But this is for other moment. Okay. Perhaps students, they don't realize, but if you, in a blink of one eye, you will be seated in this front line because the time goes by, and Ayurveda teaches us that every 10 years we are losing some capacities. That's the reality of life. And Ayurveda is offering for that Rasayana. Rasayana is the root of geriatrics. Rasayana that's what offers to have more Sathya in our body. And there are a lot of course, foods, activities, and also medicinal plants that could offer to retard, not to avoid, just to retard these specific losses. Here you have, these are Latin names. For you, Latin is like Aadhaar card. Latin is the name which offers us the possibility to properly identify the medicinal plants. Emblica officinalis, for example, 21 to 30 years. You have this plant at this store, is Amla isamalaki. And we have also these medicinal plants in Argentina. We have no time, I will proceed. You have seen Procesus Baleatan. He was a keynote speaker 3 years ago. He was one of the top scientific persons in India. And at the age of 65, he began to study Ayurveda. And right now, he has produced 3 very important books, Legacy of Charaka, Legacy of Susutra, Legacy of Bhagavata, because in this system of medicine, he found other views that is very important for the health of the people. And I want to share the most important gift that we have when we are delivering PG courses on Ayurveda is that at the end of the course, all the medical doctors come and they say, we are very happy because we are in connection again with our vocation to be medical doctors. With Ayurveda, this vocation is rekindling, and they are also very happy for that. That's the reason that I'm saying again, thank you, India. Thank you to all of you. Take care. Sayonara.
Thank you, Dr. Bera, for that very short and crisp presentation. Very, very thoughtful of you. Thank you, dear panelists and delegates, for your participation. We now request Dr. Naveen Bhatt, Head of Department, Sanskrit and Vedic Studies, to kindly felicitate Dr. Bera. We request Dr. K.P. Sailila to extend a token of our appreciation to Dr. Mitha Kotecha ji. We also request Dr. Mitha ji to receive the memento on behalf of her husband, Dr. Rajesh Kotecha ji. The memento for Dr. Rajesh Kotecha ji. Request the panelists for a group photograph, please. Sai Ram, thank you.